Intro. All right. So we're going to work through a summary of the science of transgender belief. And on my cover slide, I just have samples of um, various medical organizations that do hold a gender critical view. This would be Society for Evidence-Based Gender Medicine, Association of American Physicians and Surgeons, the American College of Pediatricians, therapyfirst.org. And of course, now those are non-religious. There, of course, is the Christian Medical Dental Association, which also has many writings, both scientific as well as theological, on this issue. Whoops. Um, we were actually as a country, the United States, first cautioned or warned against gender ideology as early as 2007 in the psychiatric literature. Dr. Michael Bailey, who has a long history of working especially with transsexual males, in 2007 published an article, "What Many Transgender Activists Don't Want You to Know, But You Should Know It Anyway." And in this article, he raised the alarm that a majority of people actually believed that male transsexuals had a feminine essence trapped in their bodies. And he said this myth um, is what's led to this narrative of a brain sex theory of transsexualism, despite neither this feminine essence belief or the concept of having the opposite sex brain neither represents reality. And this is damaging to both science and his clients, science and many transsexuals. Since 2007, gender ideology, which continues to subvert and masquerade as science, has expanded to perhaps 6 basic claims. Number 1, that people are assigned a sex at birth, that 2, some are born in the wrong body, and 3, because of this, self-professed gender identity overrides biology when you're talking about sex. Number 4, that intersex conditions prove that the sex binary is a social construct. Number 5, that the sex binary being a social construct means that, for example, trans women are women and trans men are men. And finally, number 6, that science can safely change a child or person's sex with social affirmation, drugs, and surgeries. And as we work through the rest of the hour, we're going to see why these are false. I always start with the most basic definition. What is the scientific definition of sex? And in all the life sciences, sex is defined, so whether plant or animal, by the role that organism plays, its natural reproductive design, as either the donor of genetic material during the reproductive act or the recipient of genetic material during the reproductive act. Males donate genetic material during the reproductive act. Females receive genetic material during the reproductive act. And that holds whether plant or animal. Sex is determined in humans at fertilization, or all animals, all mammals at fertilization, by sex determining genes, which are carried on the sex chromosomes. The reason I always begin with what defines sex and what determines sex is to point out that chromosomes neither define nor determine sex. Sex is innate and immutable because it is determined by sex determining genes, and it is binary because during the reproductive act, genetic material is donated and received. So in mammals, of which humans are, males produce sperm, which are introduced to the female. Females produce eggs. The sperm and egg come together to create a new organism.
Dr. Cretella, I just
Yeah,
wanted to check. Do you want to advance a slide or are you still intending to be on
I'm
this
still
slide?
on this one slide.
Okay.
Yep.
Sorry.
No worries. I know it's a lot. Not all my slides have all this writing on it. Um, we are also the transgender activists will bring in, I consider it a red herring. They will bring in, oh, but intersex people or people with intersex conditions prove that that sex is more than binary. Not true. Intersex conditions are properly referred to as disorders of sex development. Disorders of sex development are deficiencies and malformations of the normal binary reproductive system. Intersex conditions can be thought of as birth defects. And all forms of these intersex conditions, all forms of these disorders of sex development are associated with impaired fertility. So there are only two sexes, male or female, and it takes those two sexes to produce exactly two sex cells, sperm and egg, to come together and create a new organism, a new human being. Disorders of sex development do not create a new sex cell. They are malformations and deficiencies of the normal reproductive system. Fortunately, they are extremely rare, occurring in only 0.02% of the population. And there are generally two groups of these defects. Some are visible right at birth with as ambiguous genitalia. Other defects, other genetic syndromes, if you will, that affect the reproductive system may not present until later in the individual's life. And those are cases in which the outward appearance of the person does not match what their chromosomes would predict. So two general groups of reproductive birth defects, if you will. But they, again, the vast majority, fortunately, through testing and so forth, can be identified, even when they have intersex disorders, can be identified as being able to function as female or male.
Dr. Cretella, we're
Yeah.
still seeing the science of transgender belief.
Oh, you're kidding.
That was what I meant when I said we're still seeing the first slide.
Oh my gosh.
That's
I
not
didn't
where you
realize.
are. Okay.
No.
I wonder if
And it says I'm sharing screen. You're sharing screen.
We see the screen. We're still seeing the whole screen with all of your thumbnail slides on the left side. Can
Oh,
you
I
try getting out of the normal view? Are you able to
Let
like,
me stop the sharing.
okay.
I am so sorry. I was like already, where am I? Slide 5, maybe.
you have to like
Oh,
start the slideshow.
I, let's see. Let's see. I'm so sorry. Okay, hold on here.
Maybe there's somebody that knows better, but it's like
Oh,
Yes, you have to run the slideshow. I don't think you
I
were still
thought,
looking at your screen, but I could see that it hadn't been clicked. Yeah, it didn't appear to be. There you go. Well, no,
okay.
and so that's separate from so that on there, you see how you got
Okay.
F5 for slideshow?
How is that now? How are you?
We're still
No,
seeing the same thing, just your first slide and all of your thumbnail slides down the side.
I think on the top of the toolbar there's a slideshow versus view. So maybe if you go to
Okay,
that,
now you're in view. Can you go over 2 tabs to slideshow?
Uh, okay, video.
there's home, insert, design, animation, slideshow on the very
That's
top.
not at all what I'm seeing. I go and share screen. I'll
Maybe you need to do
my
escape.
slide
Oh, do you know
control.
what? Do it before you share screen. Stop sharing screen, then get it open the way you want it via
Then I
slideshow.
can't. Where are you? I'm so sorry.
It's okay. This just happens.
But you might need to stop screen share in order to click on various buttons. I don't know.
Um,
Yeah, try that. Go down to the bottom of the window and stop sharing for just a minute. Okay, now get your PowerPoint the way you want it to be.
I did, but I lose all of you guys. I can't see. Hold on a second.
Well,
You
that's
don't need
okay. You might
don't
not,
need
you
us
won't be
until
able
you
to
get
see
it
us
started.
probably.
Um, but I lose my Zoom controls. Or my Zoom
That's just
controls do it.
because we're behind your window that's open.
Okay.
But once you,
Slideshow. All right. But
once you go back to share screen, you'll see us all. But once
that's
you,
what I mean. I lose the ability to, I can't even see. All I can see is my PowerPoint, and on my screen, I can't see any Zoom controls to
oh, you
click.
just have to shrink your window a little bit.
Let's see. Let me try that. Nope. Shrink. Okay. Shrink. Slideshow. As soon as I go to slideshow, it doesn't allow me to shrink my window. It opens right up again.
Why don't you email it to me and I'll try
That's
to
what I'm
pull it up?
thinking. Yeah.
I'll try to pull it up and
I am
share it
I
from
am
my
very
computer.
sorry. We rehearsed. I don't understand why we didn't have a problem with
We
this
did.
last.
We got together last Saturday and rehearsed this, and everything went beautifully.
All right.
Just if you're recording and you want the recording to show the
Yeah,
screens as you're
obviously this is,
speaking.
yeah, that
Yeah.
would be a big failure.
We want you to have a good success.
Yeah.
This is
Are you sending it to
really
my personal?
important information. So
I'm gonna email it to you, Maria.
Okay.
thankfully you're not too far into it, so that'll be okay.
Oh my goodness. I'm so
We need a stand-up comedian to do about
yeah, that's what we should.
5 minutes of gender critical jokes while we get this squared away.
Okay. All right, here it is. Good. Of course, or have Jeopardy music playing as it loads into the email.
I didn't think to load that up.
We can't hear any of that music.
Okay. All right. That should have, it hopefully will show up on your end very
Okay.
soon, Maria.
I'm watching my email. The electrons are flying through the introverse. There it is. All right, let me open that up. Okay, while that's opening, I'm going to unpin you. I am.
I might have done it for you.
All right, and I'm going to share my screen and see if I can get that open. I don't need a tour. All right, here we are. Here we go, slideshow. How's that for everybody?
Oh, much better. Okay.
Let me get rid of this. Ugh. Well, that was not much better.
Oops.
There we go. Okay, so what slide do you want to be on? I'll advance for you.
Continue to advance. Yep. So there's what's next? Next one, DSDs next. Okay, here we are, gender.
Yeah.
If you want to back up one.
Apologies. There you go.
Yeah. So when it comes to defining gender, typically gender used to mean masculine versus feminine, and it prior to the 1950s pertained almost exclusively to the Romance languages. Take, for example, Spanish. If you were referring to a male friend, the word was amigo, a female friend, amiga. Gradually, gender also became used as a synonym for sex. But what was interesting was behind the scenes, or in academia during the 50s, particularly with sexologists, John Money and colleagues, they were the ones to start using gender with a new definition. They defined gender as the social expression of an innate sexed identity that might differ from one's biological sex. There was no scientific evidence for this, but it is what they used to justify. They were treating adult men who identified as transsexual, and that is what they used to justify their surgical interventions on these men and or on children, for example, who may have had ambiguous genitalia. Modern times, if we look at the American Psychiatric Association's Diagnostic and Statistical Manual, 5th edition, it defines gender as the lived role of male or female determined by an interaction of cultural, psychological factors with that person's biological constitution. What's interesting is that this, which is, you could consider it the Bible of the American Psychiatric Association, they clearly admit in writing that this is not something determined by genes alone. Culture and psychological factors have a significant contribution. Similarly, when they define gender identity, it's identified as a category of social identity, once again, determined by cultural, psychological, and biological factors. We hear gender dysphoria all the time. Gender dysphoria is the new name for what was once recognized as gender identity disorder, or GID, and it simply refers to emotional distress with or without some social impairment due to a person having a gender identity different from that typically associated with one's sex. Next slide. Transgender versus transsexual. Transgender is the very common term now and refers to a broad spectrum of individuals who temporarily or persistently identify with a gender different from that associated with the individual's biological sex. No drugs or surgeries are required to be identified as transgender. It is self-identification. Tumblr, this was a few years ago, had a list of 112 genders. They may be well over that now. Transsexual, which is falling out of use, referred to a transgender identified person who had undergone one or more medical or surgical interventions. Next slide. So currently in the United States, the pediatric myths that have been put forth as so-called scientific fact, starting in 2007, which is when Boston Children's Hospital opened the first pediatric gender clinic for kids. It's claimed that some children are born with a brain that's on a different page from their body, and therefore it is innate and unchangeable. The second claim is that these youth are not mentally ill. Number 3, that counseling to help youth feel comfortable with their bodies, embrace their bodies, this type of counseling would be universally futile, harmful, and unethical. And finally, what parents, well, we're all told this, but parents especially are told that trans youth with trans belief will commit suicide without gender affirming treatment. Next slide. So let's step back and take a look at the opposite sexed brain, the brain being on a different page from the body. And I want to do this sort of with an analogy, looking at another mental illness, anorexia nervosa. In this case, we have numerous brain studies that have been differences have been found in brains of those with anorexia and matched controls without. They replicate one another, so the same differences are found in multiple studies. Yet, how many of us have heard the conclusion, well, obviously then there are obese brains. This is proof. These pictorial differences, these functional MRI differences are proof that there's such a thing as an obese brain trapped in a skinny body. No, such a ridiculous conclusion has never been drawn. And yet, when it comes to the transgender issue, we have far fewer, just a relative handful by comparison, of so-called brain studies, functional MRI studies, so of lesser quality, which do not find, they don't replicate one another. And yet, with such poor quality, there's only one conclusion which is drawn, and that is that we have girl brains trapped in boy bodies or boy brains trapped in girl bodies. Do we know enough from other sciences to draw a different conclusion? And the answer is yes. Maria, could I have the next slide? So we can say, just from prenatal development, what's known of prenatal development and genetics, that no baby is born with the wrong brain or a different sexed brain. From the beginning, male and female brain tissue has different genes, different genetics, because male embryos have sex determining genes on a Y chromosome. They have a Y chromosome with sex determining genes that your female zygotes, your female embryos, do not have. We also know from a team, an Israeli scientific team from 2019, that all cells of the body express many shared genes differently, depending on whether you're male or female. Also, if you have a male embryo from fertilization from the beginning, the male infant brains, in addition to having genes on the Y chromosome that female embryos don't have, they start producing their own testosterone at 8 weeks gestation. So female infants, female embryos, lack male genes, they lack male testes in the uterus, and therefore they are not born with boy brains. Next slide, please. So what else can cause one person's brain and a matched peer, a matched control? What could cause them to look differently? In neuroscience, it's been well recognized that the brain is like a muscle, and there's this phenomenon called neuroplasticity. And the fact is, the transgender brain studies, like the anorexia studies, likely reflect the result of transgender identification. Why? Because neuroscience has established that something as basic as maternal infant gaze, as well as a multitude of behaviors, as well as meditation, prayer, thinking, in other words, and relationships, alter brain microstructure and function. So the brain is not this static thing. It is like a muscle. It's very plastic. And the fact is, transgender identified subjects have been thinking and acting for months to years in ways that, through learned behavior and neuroplasticity, may produce brain changes that could differentiate them from members of their sex, other members of their sex. Next slide, please. Well, could it still be genetic? Could this be something that is determined solely by genes or largely by genes. And again, if we just for comparison, anorexia nervosa, twin studies, many twin studies have been done looking at anorexia nervosa. And it is found that if you look just at identical twins, if you have identical twin pairs, the chance that both identical twins will have anorexia ranges from about 40 to 70%. Now, identical twins start out with 100% of the same genetics. They come from the same sperm and egg. So identical twins will always have the same skin color. They will always have the same eye color, because eye color and skin color are determined by genetics alone. In the case of anorexia, we can say anorexia nervosa is not determined by genetics alone, because your identical twins are different, right? Many of them are different. They are the same only 40 to 70% of the time. So what happens if you look at identical twins in the case of transgender identification? If you have one identical twin who identifies as transgender, the other identical twin will also identify as transgender only 28% of the time. So genes do not determine either condition, and the genetic influence. So genes can still play some role. However, for perspective, genetic influence in anorexia is greater than the genetic influence in transgender identification. So that points again to the fact, if we go to the next slide, thank you, Maria, that genes alone can influence behavior, but they do not or identification, but they don't hardwire anyone to think, feel, or behave a particular way. All human behavior, human identity, it's going to be a combination of three broad categories: genes or biology, plus environment, plus free will choices we make. And don't misunderstand me. I'm not, this will become clearer in other sides. I'm not saying that someone wakes up one morning and decides to choose a trans identity. That's not what I mean. I'm talking about other choices we make in life. But it's generally, again, your biology plus environment plus choices being made in life. Next slide, please. What is the American Academy of Pediatrics and most of your children's hospitals, what are they putting forth as the approach to virtually any and every child who comes in with gender dysphoria? They insist that you must take the child at his or her word, socially transition them, that it is recommended that puberty blockers be started at Tanner stage 2, which is roughly 11 or 12 years of age. But for the last several years, kids may be put on those blockers even as early as age 8. I have dubbed the cross-sex hormones wrong sex hormones. This, in other words, for females, they would be put on blockers between ages 8 and 12. And the next step would be to put the females on testosterone with the blockers. For boys, the boys would be put on estrogen with the blockers. And then as they get older, if they continue to identify as trans, then they would be recommended for cross-sex surgeries. For females, this would be a double mastectomy, removal of healthy breasts, for example. Males would be recommended for some of them penectomies, vaginoplasties, and sadly, these are being recommended to kids under the age of 18. Next slide, please. So we are often told that social affirmation is safe and easy to, has no harmful effects. There was a study published in 2020 by Dr. Walter Shum who is a sociologist out of Kansas State University. He took the handful of, there are, I believe, 3 to 5. Oops.
Apologies. I need to let people in the wait from the waiting
Oh,
room.
okay.
Okay.
Roughly 3 to 5 studies that claimed that the children whose parents affirmed their gender, their cross-gender identification, that those children did not suffer from low self-esteem or depression. And these three to 5 studies came from Dr. Christine Olson, and it was a single group, a group of trans-identified children that she had been following. And Dr. Shum asked her if she would share her data set and allow a reanalysis, and she did so without hesitation. He found that essentially she had omitted some data, and when he realized the studies with the missing data, as well as he also identified some statistical errors, he found that the results showed significantly lower self-worth among the children who were socially affirmed as the opposite sex. We also have at least 5 studies now to demonstrate that when you have children who are gender with cross-gender identification, if they are socially affirmed, put on the puberty blockers, 96 to 100% of them will identify as trans and request the cross-sex hormones. And we'll explain why that's dangerous. Next slide, please. So what do puberty blockers do? What are we talking about? And Lupron is the most commonly prescribed puberty blocker in America. So this is just showing at Tanner stage 2, you have very little sexual maturation, which is occurred. And so this blocker will freeze that sexual maturation, but it does much more. Next slide, please. So I like to point out the obvious, that normal puberty is not a disease. Normally timed puberty is not a disease. The absence of puberty is a disease. So when we take puberty blockers like Lupron and we put a physically healthy child on Lupron, we are by definition causing a physical disease, right? It's iatrogenic. So any little girl who is being prevented from going in, she's put on a blocker, prevented from going into puberty, she's being put in a menopause-like state. Any little boy between the ages of 8 and 12 who's put on a puberty blocker is being basically chemically castrated. So obviously, yes, we are preventing normal sexual development from these children, but what we have found as well is that the children who go through with the puberty blockers, cross-sex hormones, they come to be adults and they have permanent sexual dysfunction. The blockers by themselves will prevent ovulation in girls. It will prevent the development of sperm in boys. However, if you once you combine the blockers with the cross-sex hormones, that temporary infertility becomes permanent sterilization. Puberty blockers alone also disrupt normal bone development in both boys and girls. And that normal bone development, that normal bone mass is never regained. And we need more studies on what we're doing to these children's, the development of children's brains. Normally during puberty, the normal sex hormones are responsible for organizing the neurologic development of the brain. And there is at least one case study in a little boy where he had resulted in significant loss of IQ. Lupron is also used, it's FDA approved to be used in the treatment of prostate cancer in men and the treatment of endometriosis in adult women. And in those cases, which, in the treatment of those diseases, Lupron is associated with memory loss for both men and women. So this is a very real and scary side effect when you consider that we're giving it to such young children who are physically healthy. Next slide, please. Lupron, you can go online and look at the package insert for Lupron. And these are the emotional and psychological effects listed under the warning on the package insert. Labile emotions, mood changes, nervousness, anxiety, agitation, delusions, insomnia, depression. Prescribers, doctors are warned to watch for the development of new psychiatric illnesses and or the worsening of current illnesses. Does not sound like a drug you would want to be giving a troubled child. Recent study from 2024 out of the UK looked at the psychological outcomes of 12 to 15-year-old children who were receiving puberty blockers. They found essentially a 71% failure rate. 34% of the gender dysphoric children deteriorated on the blockers. 37% reported no improvement on the blockers. And yet, what are we told? Oh my gosh, you have to do this. This is standard of care. Not what the science shows. Next slide, please. Dr. Jack Turbin is a very vigorous proponent of puberty blockers and cross-sex hormones and has published many studies that he claims show blockers prevent suicide. So in this pubertal suppression for transgender youth and risk of suicidal thoughts, suicidal ideation, in the paper, he concludes that he has proven that blockers are good for kids. But table 3 of that paper shows that gender distressed youth on puberty blockers had double the rates of serious suicide attempts, resulting in hospitalization. So sadly, many of these so-called gender experts are so, I can't judge their intentions, but they are clearly blinded by their ideology when their own science, their own tables show the opposite of what they're claiming. Next slide, please. So temporary Lupron use plus normal puberty can cause permanent damage. And the reason for this is because we cannot, once the drug is stopped, we don't have a time machine to send the child back to go through their normal, what would have been their normal biological psychosocial development. So because we cannot restore the lost time and give them the normal development back, normal bone density has been documented to be permanently lost. There's no way for us to give them that time back to go through psychosocial milestones with their peers. That's permanently lost. We also know sex steroid organization of the brain, that's been altered and probably impaired, at least in one case report. And not that long ago, out of Mayo Clinic, a team of researchers found that puberty blockers alone may be capable of destroying sperm in boys. So male fertility may possibly be permanently impaired by blockers alone. Whereas in females, well, both females and males, when they get the combination of blockers plus the cross-sex hormones, that will destroy ovaries and testicles. Next slide, please. So to take a closer look at the suicide risk. These statistics come from Dr. Michael Biggs in the UK. And he published on this website some risk factors for various conditions to try and not to minimize the risk with transgender identification, but to put it in context. So in the UK, being trans identified increases suicide risk by a factor of 13. However, this increased risk is well within range of other at-risk youth. So youth who have anorexia nervosa, their risk for suicide is increased by a factor of 18. Youth who have documented depression, that depression multiplies their suicide risk by 20. Having neurological differences like autism increases the suicide risk by 8. And all of these issues, these conditions, anorexia, depression, autism, can be found in youth with gender dysphoria. So is there an increased suicide risk? Yes. But is it over and above that of other children with mental illnesses or psychological, neurological conditions? No, it's in the same ballpark. Next slide, please. And how about if we look back in time at the studies, because we have solid studies from the 1980s all the way into the 2000s to the present day even. Was suicide a problem back before transgender affirming care or therapy? And the answer is no. If you look at the American Psychological Association's Bible, which is the little red book up there, Sexuality and Psychology, in this textbook published in 2014, at least 75% of children with gender dysphoria will resolve by young adulthood. If we look at the American Psychiatric Bible, that's your DSM-5, page 451, indicates that up to 88% of gender dysphoric girls and up to 98% of gender dysphoric boys will come to embrace their bodies by young adulthood. And then Dr. Cantor, who is a gender specialist out of Canada, surveyed the literature and found that roughly all the psychiatric literature continues to reflect that 60 to 90% of gender dysphoric children will desist by adulthood. So without social indoctrination and drugs, most kids will get better either before or after natural puberty. Next slide. And the other thing that I want to point out, because this is so unique to gender ideology, as physicians, I don't know if we have other healthcare professionals here. Whenever, prior to gender ideology, whenever we were confronted with anyone, be it a child, a teenager, or an adult, saying, "I'm going to kill myself," we didn't turn the prescription pad over to them. We saw that as, whoa, this is a child or a person who needs help. It's a cry for help. There's something underneath going on that we need to help them figure out. Only with gender ideology, only in the case of transgender identification, gender dysphoria, are we all of a sudden supposed to take the client or patient at their word and say, "Oh my gosh, yes, you have to tell us what to do." So the bottom line here is that gender dysphoric children with SI stands for suicidal ideation. They are no different than any other youth with suicidal ideation. These children, just like over 90% of suicide victims, over 90% of suicide victims have a diagnosed mental disorder. Well, so do these gender dysphoric children. They have mental disorders underneath that have not been fully treated, have not been fully resolved. So suicide prevention for gender dysphoric children should be the same as for any other child. Namely, let's treat the underlying disorders. And there are at least 16 case series of counseling success among teens and adults with, it might have been labeled under various labels, gender identity disorder, for example. so at least 16 case series in the psychiatric literature to demonstrate that, yes, even in teenagers and adults, you can see a change in their gender identity, which includes embracing their bodies when the underlying conditions are treated. Next slide, please. So what are we doing when we ignore psychotherapy, when we ignore the underlying, we don't even go looking for any underlying traumas or issues, and just put these young people on cross-sex hormones? If we put them on cross-sex hormones, males get put on oral estrogen, we increase their risk for heart attacks, blood clots, and strokes. Yeah, I'm so sorry. I'm just seeing in the comments. I'm sorry if I have been flipping gender and sex. I apologize. You're right. I should be talking about biological sex. Correct. So oral estrogen in males will increase their rates of heart attack, blood clots, and strokes significantly. Also contributes to gallstones, high triglycerides, increases. You almost never see breast cancer in men, but rates of breast cancer go up as gynecomastia and large breast tissue. And of course, the male risk for breast cancer goes up as well. Females who are put on testosterone, increased risk of heart attacks, strokes, overproduction of red blood cells, that word erythrocytosis, think thickening, sludging blood, a dysfunctional liver, high blood pressure. Interestingly, testosterone also in females may increase risk for breast, uterine, ovarian cancers. And the young women, many of the young women who have transitioned as teens and now come out as detransitioners, will say that they're stuck with facial hair. So the hirsutism, they've got a 5 o'clock shadow every day, enlarged Adam's apple that won't go away, and will describe their voices as being broken. Next slide, please. We have documentation in America of young girls as young as 13 having double mastectomies for so-called male chest dysphoria. Females as young as 16 being recommended and given hysterectomies, and males as young as 16 or 17 being surgically castrated, having penises amputated and then used to create, you'll hear the term neo-vagina, but what is being created in these boys or young men is essentially a genital wound. It's a pouch, a wound that has to be repeatedly dilated. No one can create a true vagina. You cannot, it's false to be told that we can create sex changes. Next slide. This is a study from 2011, which is still very pertinent in that it was done in Sweden. It is a 30-year follow-up of adults who underwent hormones and surgery for their transgender identity. And it's looking at death from all causes and over time. And this is it goes, the x-axis runs from year 0 to year 30 after the treatment. And the dark gray, the solid gray line at the top reflects age-matched women who do not identify as transgender. And you can see that basically the women live the longest, over 30 years. The dark solid black line are men who are not transgender identified. They're just in the general population. They die off a little more quickly than the women, but what's most dramatic is the dashed black line. The dashed black line, those are men who identify as transgender, used hormones and underwent surgeries. They die the most quickly. You can see a dramatic drop off, perhaps beginning at the 10-year mark after treatment, after surgery. And the dashed gray line you can see women who identify as transmasculine, they die off less quickly than the trans-identified males, but significantly faster than those who do not undergo transgender, significantly faster than the general population. So even though they underwent hormones and surgery, the transitioned adults were 19 times more likely to commit suicide, again, compared to the general population. So transgender or gender affirming medical treatment, gender affirming surgeries, do not solve the suicide problem at all, and they contribute to death from in other ways, as we reviewed in the previous slide, heart attacks, strokes, etc. Next slide, please. So we are also told by the gender experts that, you know, these children or teenagers who present as trans or present with gender dysphoria, they don't have any underlying psychological issues. Again, not true. And we have multiple studies now. This one out of the Kaiser Permanente, I believe, looked at 8,000 students, and it was just incredible. But psychological disorders in the trans-identified youth were 7 times higher overall, hospitalizations over 40 times higher, self-harm 144 times, up to 144 times higher, and suicidal ideation 25 to 54 times higher. What's interesting, because this was a chart review, they identified that all of these conditions occurred before any gender dysphoria symptoms and before any trans belief was declared. So it argues for the fact that these underlying conditions, these underlying traumas, predispose or trigger, probably in combination with the indoctrination, the belief in a trans identity. Next slide, please. Again, prior to gender ideology being so widespread and accepted, psychiatrists and therapists were taught to look for certain predisposing factors, and these same predisposing conditions are found in our youth today who are presenting as gender dysphoric. Reactive attachment disorders that can occur early in childhood between children and parents, adverse childhood events, and that could be anything from physical abuse, verbal abuse, sexual abuse, even bullying at school. Neurologic differences like autism or ADHD, pornography addiction, OCD. There's a category of porn, sissy porn, which some males who have detransitioned, they have identified this particular addiction as being a factor in their adopting a transgender identity. Major depression with or without psychotic features, generalized anxiety, social anxiety, internalized homophobia. These are perhaps the most common underlying conditions that have been found and are treated, the conditions that are treated by gender exploratory therapists. These would be therapists who want to first do no harm with and help children and young people avoid the medical track. Next slide, please. So indoctrination and social contagion clearly are playing a huge role in our modern times. And this chart or graph first appeared on a radical feminist website. And it's a lovely illustration from on the x-axis going back as far as 1976 and then forward to 2013. And the dark gray, the solid dark gray line reflects boys presenting with gender dysphoria. The light gray reflects girls presenting with gender dysphoria. And so for the very longest time, they were very close between it's 0 and 5. Yes, only until 2013. And you're correct, it's skyrocketed further for sure. But what's nice is that it shows how, with the launch of various social media platforms, how the spikes really shot up. So blue reflects the launching of Facebook. And then with green, with Tumblr's release in 2007, that is where we saw even a flip in the sex ratio on this chart, where the girls outnumbered the boys. And then Instagram is reflected in red, and that was around 2010 that it was released. So you have social media, we have our schools, our libraries, all young adult literature. Deviant art is very important. Yes, deviant art. And I don't know when that came out, but you're right. That is definitely a factor for many youth. Next slide, please. So to summarize causative factors, again, we're talking about vulnerabilities. For example, certain personality types heavily influenced by genes. Autism, for example, would be a genetic vulnerability, plus environment, plus free will choices. Social reinforcement, contagion, as we just saw in the previous slide, internet, all media, all sources of media, family, schools, clubs, literature. In some cases, there is parental psychopathology. Family dynamics may contribute. And oftentimes with family dynamics, especially if we're dealing with young children, it's nothing sinister on the parents' part at all. I think I've often told the story of one little boy I had in my practice in 2010. He was 3 years old. His parents, his mother gave birth to his sister with special needs. So for 3 years, he was the apple of his parents' eye. He got all the attention. Now, all of a sudden, between age 3 and 5, with this new baby sister and special needs, he misperceived the sudden lack of attention that he was receiving as mommy and daddy only love girls. I have to be a girl for mommy and daddy to love me. And of course, that only came out in family therapy. But once it was identified, now it could be addressed. And within a year, he no longer wanted to cross dress or anyway. I just want to make sure that we understand. I'm not blaming parents, but it's just to help people understand that the way children perceive their environment can have a huge impact in this area. Free will choices such as what, so many of our detransitioners now are trying to warn parents and share that, binges on the internet. There are so many adult transgender predators out there who are convincing vulnerable youth in various chat groups or, Reddit, YouTube, everywhere, that, oh, if you're uncomfortable during puberty, that's just proof that you're trapped in the wrong body. They know how to prey on these vulnerable youth. Next slide, please. So you may have heard about the international systematic reviews, which have been done across Europe. They're international. They've looked at, they start out with nearly 10,000 studies, and they grade them according to scientific rigor. And then when they're left with the best constructed, they do a deep dive and they analyze, the scientists analyze what can definitively be said. And we have roughly a dozen now, and all of them agree that at best, gender affirming treatment, whether drugs or surgery for children and youth, must be considered experimental. Next slide. So what this is translated to, this is the United Kingdom, Sweden, Finland, and Denmark, and hopefully soon also Norway and France. But right now it's just these countries have restricted pediatric transgender interventions to what's known as randomized controlled trials. So essentially in these nations, gender dysphoric children, the standard of care now is psychological evaluation, psychosocial intervention with the individual child and family. In certain, I haven't seen the criteria yet, but they are developing criteria in which they would, if a child would be referred for a puberty blocker, that child would have to be enrolled in a study and followed extremely carefully, and have so that everything is done with scientific rigor. And next slide. So in my opinion, classifying it as experimental at best is good, but in my opinion, we should not be enrolling any child even in a study. Why? Eugenics, anyone? We're talking about children, and we're talking about sterilizing them. Whether we're talking about sterilizing them either chemically with puberty blockers and the cross-sex hormones, or sterilizing them with bottom surgeries. And that is not treatment. In my professional opinion, every child and every family should be treated with psychosocial methods and move forward. We should not be, certainly not before adulthood. I do not believe we should be putting anyone at risk for sterility. And if we're furthermore, even on the cross-sex hormones, if you put young people on the cross-sex hormones, they need to stay on those cross-sex hormones for their entire life. You're medicalizing them so early. I don't believe anyone should be subjected to that. We're sterilizing, diseasing, and mutilating troubled youth. If we go forward with that, even under scientific rigor, in my book, it's still eugenics. So that's my take on it. Next slide. Now, although children with underlying mental illnesses or traumas are going to be most at risk, because of even normal childhood development, I want to go through a couple ways that we can see all children are vulnerable. So Jean Piaget, psychosocial social psychologist, developed the cognitive development stages of childhood. And between the ages of 2 and 7 is when gender identifying, which means a child identifies what sex they are. It's between 2 and 7 that this happens. Next slide. Dr. Lawrence Kohlberg actually broke down the normal gender identity development of kids between 2 and 7. Generally, by age 3, most children will be able to say correctly, I'm a boy or I'm a girl, based on their bodies. But they still think that your sex can change. They still think that they don't grasp that it's permanent. Generally, by age 5, a little boy will recognize, oh, boys grow into men. A little girl will recognize, oh, girls grow into women, generally by age 5. But they still think, they don't quite understand that it's permanent. Kohlberg and Piaget found that generally it's not until age 7, that a child will understand, okay, just because a guy puts on a dress, that doesn't mean his body has changed. He's still a guy. So for this is why, next slide, please. Oh, the other thing between ages of 2 and 7 that goes along with this pre-operational thinking, magical thinking. Between 2 and 7, children will believe that just by thinking about something, they can make it real. And that sort of goes along with, oh, they'll look at changes in external features and think that it means something physical has actually, or dramatic has actually changed. So attributing events that happen around them as being caused by their own thoughts and or changes in external features. So this is why for little kids, it's hard for them to comprehend that sex is permanent. Next slide.
Dr. Cretella, just to give you a time, we're in about an hour.
Yep, and I probably have 2 slides left, so we're just about done.
Great.
So understanding what happens is going on in the preschool to age 7 brain, now you can understand why drag queen story hours are so damaging to this age group. In addition, there's something called the primacy effect, in which the first way you hear or learn about a subject is typically what you really most firmly believe. So between their cognitive immaturity and the primacy effect, it really does set children up to be gaslighted very easily. Not to mention the sexual grooming aspect as well. These are men who are dressed as very gaudy and sexualized women, and many of them have predatory backgrounds as well. So next slide, please. Going forward, looking at why teenagers are especially vulnerable to this ideology. The dark purple, Erik Erikson, psychosocial development. The primary job of any adolescent is to develop their identity. If they succeed during the adolescent phase, they will have a solid identity, versus if they fail, there's role confusion. Next slide, please. And this is why social contagion and indoctrination have such an impact on our teens at this point. The activists are very much into love bombing. Oh, you feel anxious, depressed, uncomfortable in your body. Oh my gosh. Yeah, you're trapped in the wrong body. Your parents just have to accept you as you are. And if they give you any pushback, hey, we will be your new family. We love you. We'll be your glitter family. So take the teenage social and cognitive developmental stages combined with love bombings, social contagion. It all makes sense. It's a very vulnerable time, and easy for them to get sucked in. Next slide, please. Similarly, our children or teenagers who have autism, they have struggled their whole lives with social acceptance. They want acceptance. They want to fit in. So love bombing and the lies of the transgender activists, especially if you have an autistic teenager, very vulnerable. Next slide, please. And we're just about to wrap up. I do want to point out a couple of our own our Advocates Protecting Children resource page. We have common sense care videos as well as a book. The videos are all on the website. If some people like to have written material as well as the video, so we gathered up the transcripts into a book, which can be purchased on our website as well. and that is for parents who are dealing with children in their own family who are struggling with this. And Maria, I apologize. Maria is the author of Desist to Trans and Detox. It has come under, it was purchased by Sophia Press, Maria.
Yeah, Sophia Institute Press.
Sophia Institute Press. So it is still available under different cover. Now, the clinical guide for therapists working with gender questioning youth. Although this is for clinicians, I recommend the website. Go to the website therapyfirst.org because they do have a section for families. So therapyfirst.org online does have some good resources for families. And the last book I have pictured, I'm good friends with Miriam Grossman, Lost in Transnation, A Child Psychiatrist's Guide Out of the Madness. Just an outstanding summary of the gender ideology. And she has a host of resources for parents there as well. And next slide is the end, and we can advocatesprotectingchildren.org, biologicalintegrity.org. These are the two, well, Advocates Protecting Children, I'm on their board of directors. I'm proud to be. And biologicalintegrity.org is the website put up by the American College of Pediatricians dedicated to gender dysphoria and transgender identity. So I encourage you to check them out too.
Okay. Thank you so much. That was a great presentation.
And I so apologize for the late start. Oh my gosh, and the
No.
confusion. Yeah, but I'm
It
glad.
happens. It happens. And I was not able to keep up with the chat since I was screen sharing. So I want to look and see if we have questions for Dr. Cretella. If anyone put them in the chat, I'm gonna scan through these really quickly. I have appreciated so much your story
Oh,
about the little boy.
good. Thank you.
That speaks so much to how somebody can be confused and
Right.
misinterpret something. Okay, a question here. Why did doctors start to use puberty blockers for precocious puberty? Was it just in a quest to keep individuals from not growing tall? Either way, wouldn't this have been an experimental treatment on children? What are the adverse effects of going through an earlier puberty?
That, that's those are excellent. Those are excellent questions. I do. Oh, I'm so sorry. You know what? I just got distracted for before I answer that question. There's someone just asked if we will have references and resources posted. Yes, when the recording is posted, we will make sure to post a list of references as well. So with the my understanding, so I'm a general pediatrician. The best person to answer the questions about precocious puberty would be a pediatric endocrinologist. However, my understanding is that with precocious puberty, the changes that we're trying to prevent is premature bone closure. So it's not just maybe lack of short stature, not just lack of height, but also some of the psychosocial trauma that might happen if you had, oh, I don't know, let's say a 5-year-old going through menstruation, for example. I can't answer, for example, how frequently would a 5-year-old present with precocious puberty? I don't know. I can tell you, however, that all the side effects of Lupron that we that are on the package insert. So in terms of emotional, mood swings, for example, I've seen individual reports come out that young women who were treated for precocious puberty appropriately as little kids are presenting now with bone fractures very young, like in their 20s. So it is Lupron is a highly controversial drug, even for precocious puberty. So you're correct to raise the question. I do not know the history of how it was FDA approved for precocious puberty, but at least precocious puberty is a disease. So, whereas when Lupron is marketed for gender dysphoria, we're talking about a psychological condition in a physically healthy child. So that should be no pass go. But in cases of precocious puberty, I and many other pediatricians, actually all pediatric endocrinologists, should be making it clear to the parents that Lupron is a choice, that they should be, if they choose Lupron for precocious puberty, they should be given full informed consent. Package insert should be brought out. These are the potential negative side effects, and doing nothing, just letting precocious puberty happen through to your child is an option for sure. Especially, I would say, if it were, for example, in girls, puberty may start as early as age 8 in girls, and that's the early normal age. So if I had a 7-year-old, I wouldn't be pushing those parents. I'd say Lupron's an option, but I'm not going to push it this way. I would give you informed consent. Yeah. So
Okay, there are two questions that they seem very different, but I think they're related, so I'm going to share them with you at the same time. Since people still look to, quote, expert opinion when faced with this issue, and expert opinion is divided, why would they listen to you compared to the science? It appears professional associations are a key to refuting erroneous positions, yet financial incentives appear to support erroneous positions. The related question is, why are they continuing to do this if these are the results?
Money. All right. So, yeah, all good questions. So the reason to follow, first of all, it's not just Michelle Cretella. And that's why my cover slide did have other medical organizations. So there are multiple American medical organizations who, from at least 2016, have been promoting the actual science to show that there is harm. So why would you follow the less mainstream view? Because the less mainstream view, at least in America, is based on first do no harm. It is irrefutable that puberty blockers together with cross-sex hormones will cause permanent sterility. It is irrefutable that the cross-sex hormones by themselves cause permanent changes. Why have we been unsuccessful, or why have we been marginalized so far in this country? And I would say because of the money aspect, because big pharma is behind it, and also because the leading gender experts, many of them are they're in positions of authority to influence medical education, to influence medical journals, etc. What is going to change that? I predict that in the next 2 years, we're going to see a dramatic shift. And this is why, because over the past year, we had at least 13 lawsuits in this country filed across the country by detransitioners. And these lawsuits, some of them have been against Planned Parenthood International, which is not Planned Parenthood International, against Planned Parenthood of America, which is the largest organization, or it's the organization providing the greatest number of prescriptions of testosterone to college age women. A lawsuit was filed against the American Academy of Pediatrics because the American Academy of Pediatrics is perhaps the leading expert organization pushing transgender interventions. Their white paper is entirely flawed. The references they cited, it's been fact checked, and the references that the AAP cites as supporting transgender affirmation contradict those very references. So when that goes to court and is brought out, and we see not only the individual physicians, but these organizations having to pay and backtrack, that you're going to see children's hospitals, insurance companies, that they're not going to want to back this anymore. So it's sad to say that that money is a big factor, but when the lawsuits actually come to court, and it can take 2 to 3 years. So these 13 lawsuits were filed in 23 and 24. So the next couple of years, you will actually see them playing out in the courts before juries of these young people's peers. And I think we're going to win. The truth's going to win.
We have about 5 more minutes until we get to 2:30, and there's just one more question, I think, and I'm not sure if you can answer this. It might have a legal aspect to it, but how can they validate randomized control trials when it is already deemed experimental? Wouldn't that be a Nuremberg Code violation since children cannot consent?
That's a really good question that I don't know the answer to, but I would refer you. I believe because this is happening in the UK, there is GenSpec UK is I think they just had I haven't read the article yet, but they were I saw the headline, and they were critiquing this concept of ethical studies with puberty blockers for gender dysphoria. But I haven't had a chance to read it yet. But you may be able to go online and look for Stella O'Malley and GenSpec. They are following what's going on in the UK with the randomized controlled trial.
Okay. Thank you so much, Dr. Cretella. This has been really helpful, really informative. Yes, everyone, I had a question in the chat. Is this all going to be made available? Yes, the video will be made available. All of the resources we'll have on the website. Give us a few days to get that up, but it will be available. So thank you so much. I'm going to go ahead and end the recording, and please join us